Hi everyone, this is Mr Neel Raithatha, also known as the Wax Whisperer. Thank you for tuning into this latest video. So for a patient who attended with bilateral, when we say bilateral, we mean both ears, glutinous, stodgy, whatever you want to call it, earwax. It can be one of the most frustrating types of earwax to remove because when it's glutinous and sticky like this, it can quite easily block the Zollner suction probe. So within seconds of entering the ear, I decided that I needed to put some olive oil drops in just to help bind this wax and lubricate the suction probe so it doesn't get blocked. But even still, as you can see there, I'm just wriggling the Zollner suction probe, trying to unblock it. So we're just near the entrance, and I'm just trying to lift some of this sticky wax off the canal wall. If we can loosen it off the canal wall, it just facilitates easier extraction. And you can't see now, but once we've got this plug of wax out, the patient had a slight abnormality in this particular ear, which could be the cause for their wax buildup, other than the sticky nature of the earwax. If you have really sticky earwax, it's plausible that as this wax is trying to migrate out of the ear naturally, it sticks against the canal wall and it gets trapped, and then you get a buildup behind it. But also with this patient, at the entrance of the ear canal, they have a trench there. Now, we all have a slight... the ear canal goes down slightly as we enter, then it goes almost immediately back up. So generally the ear canal's inclined. However, this patient has got a deep valley just at the entrance of the ear canal. And it could also be, it's all very plausible, that as the wax is migrating out of the ear, it's getting trapped in the valley and you're then getting a build-up behind it. So we're almost there with this one. The plug of wax is, I think there's probably a bit more actually than this. But I've managed to remove a big plug of wax here, and it's been there for a while. You can tell by the colour it's a bit darker, so it's oxidised. In terms of the patient's symptoms, they are alleviated now because we can see the eardrum. Now this is you'll see the valley appearing slowly, so the patient's still got some soft, sticky, pulpy, glutinous wax. You can describe it as almost like soft butter or peanut butter consistency. So with the suction it can get blocked, or with a scoop sometimes you run the risk of almost spreading this soft wax. It's like when you're applying butter on your toast, you're spreading the layer, and it can happen with a Jobson horn as well sometimes. That was actually occurring in the left ear. So after this is the patient's right ear, you'll see the patient's left ear procedure. Eardrum's nice and healthy, but here's the valley, and we're having to almost really angle the endoscope down to visualise this. It'd be quite easy to almost ignore this valley and it not being in view. So I'm just going in and I'm tilting the endoscope downwards to get the view, and you can see there still quite a lot of wax, and you'll see when I'm scooping it out, it comes out in big chunks. So there's a fair bit of wax there. So the patient reports chronic earwax impaction. So if it is the abnormality of the ear canal, it's very likely it's an anatomical one that's been there since birth. The patient did ask why people get sticky wax, and I explained dry wax, the wet wax. So there's a specific mutation to the ABCC11 gene, which determines whether or not you have soft wax, or wet wax should I say, or dry wax. If you have wet wax, you have a dominant guanine allele. So your nucleic acids, they come in pairs, adenine, thymine, guanine and thymine. I think they're correct. And if you've got a dominant guanine allele in this particular gene, you have the wet wax gene. So that gene is responsible for the same sweat glands under your armpits. They're called modified apocrine glands, and they produce an oily sweat. If you don't have that dominant guanine allele, and instead you have a homozygous, so a pair of the same recessive adenine alleles, you have dry earwax. And the type of gene you have, obviously, it can go back to ancestries. So they say if you're from let me get this right, from an African heritage or European heritage, you're more likely to have the wet wax gene. And if you're from the Far East or from the North Americas, you're more likely to have the dry earwax mutation. So just a bit of trivial knowledge there if ever you are on Who Wants to Be a Millionaire and you're asked why some people have dry earwax and wet earwax. Well, you can call a friend, you can give us a call and I'll help you out as long as you split the winnings. Otherwise, if you remember the answer I've just given to you, you can claim the winnings for yourself. So just into the left ear, again, this wax is very glutinous. You probably saw that I did use a Jobson horn, but it did almost spread the wax at the base of the ear canal. So I've just gone back into the Zola trying to lift this off the canal again. And it's a bit frustrating because I did put drops in straight away before I even started the procedure in the left ear. I put some olive oil earwax sprays immediately. And it can get frustrating when it gets blocked. Now, what do we do if it gets blocked? We use particular suction probes that come included. So these are all single use. Once you've used it with a patient, we safely dispose of it. So I've got a clinical sharps bin. We put it in there. And for each suction probe, they are sterilised. So they come in a sterile pack. And they're included in the pack is a cleaning rod. So if they do get blocked, sometimes you just wriggle it and it unblocks itself. And sod's law, you come out here and you wriggle it and you're just about to get the cleaning rod and it unblocks itself. So that happens quite a lot. But you can push the cleaning rod through. So we've got that wax out of the left ear. They don't have as a prominent valley at the entrance as the right ear. Eardrum's nice and healthy. It came out in a big plug, and I've just taken a quick video of all the contents of the patient's ear. I hope you enjoyed that video, guys. Take care and speak soon.